So we just landed in Medellin. Great flight. Big thanks to American Airlines, taking care of us business class as usual. Haven't been to Colombia in 10 years. This will be interesting, and I'm super excited to get these stem cells. Smiling in your Where I am. So I heard about Bio Accelerator from a lot of really great athletes that I've worked with, and it really piqued my interest because I'm a former athlete myself, and I've really accrued a lot of damage over the course of my career, both in athletics and working as a manual therapist. I'm an Hyperbaric and chiropractor at Jackson Wink MMA, so I work with a lot of MMA fighters. And some of them are really big, and so when I'm adjusting them and working on their bodies, I'm dealing with a 250-pound ball of muscle. And so all that force goes into my wrist, goes into my hips, goes into my shoulders. So when I started seeing some of the folks, the pro wrestlers, the UFC fighters coming down here, it really piqued my interest and made me wonder, hey, what's going on there? They seem to be having great results. A, I wonder if this could help me a lot and extend my career. And then B, I need to experience this for myself, so when the other fighters ask me about it, I can have a concrete answer. And I've really had my eyes on stem cells for a long time.
Looking good, Ben.
Styling, profiling.
Wow.
Check me out.
Wow. You get to take a nap?
So it's your first time in a hyperbaric chamber, right?
Yes. First time. I'm a hyperbaric virgin.
So the thing inside is like when you're in an airplane, your ears pop.
I can G-lug here. Feels like a roller coaster.
Yeah.
Yeah, I've never done a hyperbaric chamber before, so it was really interesting. It felt like I had, oxygen in my nose, cannulated oxygen. The pressure was it was actually really soothing for me, and a lot of people find it uncomfortable because they're in a chamber or in a container, but for me, that pressure on my joints and on my body felt really amazing. It was relaxing. I could really feel the oxygen going through my nose and into my brain. Made me feel awake, alive. And on top of that, I got to watch really cool shows inside of there too. So I got to catch up on my Rick and Morty.
So, yeah, we had a lot of issues.
Oh.
With your body.
Oh, with my body. I was like, oh no, I'm getting deported already. So I came down dealing with a multitude of different injuries. So I've got a lot of cartilage damage to both of my wrists, but my left one being worst. I fractured the bone in there previously. I dislocated all the fingers in this hand. I've torn the triangular cartilage there. I've got really bad arthritis in my knees, my right worse than my left, severe arthritis in the left hip, rotator cuff damage, labral damage, so a myriad of injuries. On top of that, I was also, I got an autoimmune disease caused by improper prescription of antibiotics in the United States about 7 years ago that caused a pretty severe autoimmune disorder of my gut. Unfortunately, that's a cyclical issue. So when you have inflammation of your gut, that leads to inflammation everywhere else in your body, which is why having real food is so important. But that inflammation makes all my other injuries significantly worse. So coming down here, what I was looking for was really to decrease the inflammation in my gut, in my joints themselves. And what we went through is I did 50 million of the golden cells IV.
These are your stem cells, okay? Both 50 million Washington mesenchymal stem cells for the IV therapy with 25,000 units of heparin in today's date, okay?
So that's the highest quality, top-notch stem cells that you could get.
But what we like to do in here is that we like to ask you guys to write everything you want from the stem cells, like wishes, intentions, expectations to become in your life, to write them down. A lot of people goes like love, happiness, health, no more pain.
The pressure. What I wrote on my stem cells is I want to physically still be able to help people when I'm 60 years old. In my line of work, it's very hard on my body. Force in equals force out. So every time that I'm working on somebody and I'm helping them physically, that toll goes back into me. So I want to make sure that I'm still capable of helping people, when I get to my middle-aged years and still able to help people in their lives.
So the vaccine and stem cells?
Yeah. Absolutely. Listen, if I'm going to recommend things to my patients, I need to know that I've gone through it first. That way I know the benefits and the safety. So I'm more than willing to be the guinea pig when it comes to that kind of stuff because I take other people's health really seriously. You said? Intrathecals in the epidural spaces in the spinal canal.
And?
Oh yeah, brother. That day, it was amazing. I slept more than I've slept in probably 15 years. It almost felt like this soothing sensation going through my intestines, through all my joints. Honestly, it was euphoric, that whole 24 hours afterwards. Got done checking out all my joints. So he thinks that we have a pretty good prognosis on everything except for my pec tear. And that's kind of what I expected as well. So it's always good when you hear another medical professional sort of validate what you think is going on. So I'm really excited, especially about like my GI tract, my hips, my knees. These are things that I see all the time in the office, and these are things that, especially the joint related stuff, that I can't personally fix, you know, doing conservative therapy like we do. So I'm always looking for places that I can refer out that can really help with that deep stuff. That's kind of why I've sent a couple people down here. But I also don't necessarily feel super comfortable referring tons of people unless I've experienced it. So that's the main reason we're here, and so far everything's been awesome. The doctors have been great, personable. Super excited now. After that, we got to the less pleasant stuff. So I had injections subpatellar, so underneath my kneecap on the right side. I had them intraarticular in the joint on my left shoulder. I had them in the muscle on my left shoulder as well, and then also in the trapezius and rhomboid, so the muscles surrounding the shoulder. I also had the hip, so intraarticular there as well. So a pretty decent sized needle. I got a giant needle going right now.
Very big one.
I don't get any painkillers for this.
No, sir.
Afterwards?
We are doing the intraarticular injection with the golden cells, so those super powerful mesenchymal stem cells. So the idea to bring down the inflammation in the joint and hopefully get some of that cartilage to regenerate to help me be able to keep working, keep standing, keep working on all these athletes that you guys like so much. Woo! With no painkillers.
Okay, Bo, a lot of things, okay? Bold height tower, this is your ID number, 20 million Barton-Johnson mesenchymal stem cells for the left shoulder, 40 million for the right knee, 10 million for the left shoulder intramuscle, 5 million for the left wrist, 5 million for the right major pectoralis, and 20 million for the left hip. Okay? So a lot of things going on.
We are going to the big needle first. The worst.
Cold, I'm so sorry.
I've actually never had a joint injection of any kind either. I've had a pubic symphysis cortisone shot, but that's it.
Oh. That's it, Bo. That was a pinch. Now the stem cells, okay? Breathe.
Ooh. The hills are alive. La chona se mueve.
You're done with the hip. You're done.
Did you feel it go in?
Yeah.
Was it painful?
Yeah. I feel like it's gonna suck the same amount. Maybe more. Because I knew that was gonna be painful, so maybe this one won't be quite as pressureful.
Okay, relax the quads. Perfect.
Okay, Bo, deep breath. He's in the joint. Okay? Breathe. You're done. You're done with the knee, okay? Muscle, left shoulder. Left wrist.
Yes. In the United States, it's not. You can't.
It's mandatory for the government to go to a really poor city, village.
Keep talking, no worry, okay.
To a really poor village and things like that. Breathe.
Yes.
And you have
Keep
to
talking.
go a year in a first level hospital, which they don't have many things, so
Right.
they have to learn how to be resourceful.
Perfect.
Oh boy, oh boy, oh boy, oh boy.
Breathe.
Okay, no
It's a
worries.
smaller needle. It's a smaller. Okay, take a deep breath. 1, 2, 3. Breathe. Another one.
Perfect.
kind of hurt, so breathe.
We'll see. He's going in again.
Yeah.
Oh, it's intramuscle, right?
Oh, it's pretty easy.
Joey, if you want
You
to
feel it?
be here.
It's injury here.
Mm-hmm.
Yeah, the fibrocartilage, the triangular, and the apophysis of the woman is like fragments, a lot of fragments there.
Yeah,
Yeah. You must take care of
it
them.
slides in and out sometimes. So
Exactly.
I have to pop it back in. Like,
Instability, yeah.
yeah. So I have to get a smaller phone. When I hold my phone, it moves anteriorly,
Yes.
and then I have to pop it back
Yeah.
posteriorly.
Know what you mean. Okay.
Breathe.
Okay.
Wow.
Breathe. Breathe.
Yeah, so fully ruptured this bench pressing back in 2011. One of those NFL combine challenges was on TV, and so I was like, I wonder how many I can still do. I did 225 like 31 times, and then so I was super fatigued. And then I was like, I wonder how many times I can do 275. So on the fourth rep, I was on the way up, and it just sounded like a towel tearing. The muscle just shred in half completely. Not bad. Yeah, the hip was a deep one. I felt a lot of pressure there. Same with the knee. Shoulder was easy. I've had a lot of needles on that shoulder anyway, and then the wrist as well was not so bad. So I'm working with my hands all day.
It was a little bit narrow. You have a cartilage damage.
Like 10,000 pesos.
Oh, 10,000, that's not a
not
lot.
too much.
That's like $3.
Okay, I've got the monetary translation wrong. I feel like at
10
least
million thousand.
I feel like Tesla stocks. What's up? What I'm hoping is to stave off a hip replacement for as long as possible. I'm only 37. I stand all day, so hip replacements have a very short life on them still. So what I would like to do is, if I do have to go down that route, I'd rather do it in 20 years than now.
Do they IB rule? Yeah.
See, folks, we got to do a fair trade. If they're going to take care of me and heal my body, I got to help them out too when we can. Take care of our Colombia's nurses. Stomach. It's tight.
Yep.
And then you feel it start to slowly fade away.
La presión.
Mejor?
So after you left on Wednesday, an orthopedic surgeon came here and do another more procedures, and he checked my back, and he was like, you had a lot of myofascial nerves, like trigger points on your back. You have a lot. Okay. Porque tengo la espalda peluda.
Very good. How's that? So bring your head up. Okay, let's stand up. And face this way. So both hands go here. So go like that. Get there. Get there. So, like that. Pull. Good. And go and pull. Good there. Okay.
Está bien. Sí, ya está bien. Oh, lo que le...
I don't want to move that. I do.
Okay. Yeah, so.
I don't want to. Puta madre.
Okay. Good. That's loud, huh?
Yeah.
How's that? Looser?
How do you feel?
First time?
Yeah. The neck is better. And my lower back, yeah.
So you still feel here?
A little bit.
A little bit? Yeah.
That's good.
Yeah, ahorita?
Sí. No,
Yeah. Better.
How's that?
Oh my god. Okay, the last week I just felt like a spasm, like a neck pain, and it was like pretty much like this. And after that, like the pain continues in my neck and pretty much like in my back, in my higher back.
So look down.
Yeah, that's so painful. Like, no. Ouch!
So yeah, there's not very many chiropractors in Colombia. My school had a program with Col Deportes. So sometimes they stay there and they live in Bogota afterwards.
And also, it's not really used to, like, when you have a back pain, you just go to the doctor and they give you like anti-inflammatory and all of that, but it never goes up your mind like, oh, I'm gonna go to a chiropractor. Never.
Yeah.
Yeah, no.
Even the physios in this country don't do a lot of manual therapy. It's more just exercises. So
Yeah,
that's
physical therapy and all of that.
Yeah, the physical therapists in the United States do a lot of this scraping and needling and a lot more hands-on. Here, ultrasound.
Yeah, it's more medical.
Eyes.
More medical, not so much as an alternative.
Yeah.
Painful. Really painful.
Yeah, right there. So when the muscle's having a spasm or it's tight, what we're doing is pressing on it to make it release. So it kind of tricks the muscle into thinking it's shorter than it is, and then your body will reset it by releasing it.
Oh my god.
There's the troublemaker. Okay, try to shrug that shoulder up.
Dios mío.
Levante su hombro.
Oh my god, I'm sweating.
So you're gonna bring it right here.
Ay, Dios mío.
So, relaja.
Ay, no, espérate. Ya.
Most relaxed you could possibly be.
Ay, no, I'm not.
She's fighting. I'm gonna have to lay her down probably. Super locked up on this left side. Maybe lay on your back.
Ya. Boca arriba.
Oh,
Boca arriba.
Yeah. Okay. Okay. Go super.
Relaja. Hijo de puta. Oh my god.
Probably have to traction her because she's fighting so hard. Drop your right shoulder down.
What is that?
Move your.
Ay, hijo de puta. Ay,
There.
hijo de puta. I'm trying to be the most relaxing
know.
person. I'm trying to do my best.
Okay. Eso.
Like this?
Okay, you just played dead. Just be a noodle. Actually, put your hands by your sides.
Like this?
Yeah, just whatever will make you the most possible relaxed you can be. Think of yourself like a wet noodle. Just
Oh my god, but I'm so tense.
like Weekend at Bernie's. That's not gonna hit.
Hijo de puta. Puta madre.
Sí.
People is. Oh my god.
Put your hands here. Put it right there. Okay. Go both hands like this. So a little lower and one on top of the other. So go up there. Look down. Yeah, pretty good. Let's take this hand. Up there.
Oh my god.
Go like that.
Hijo de pucha. Pero es que tiene mucha fuerza. ¿Qué está apretando ahí? Tu músculo.
Subscapularis.
Yeah, better.
That was easier?
Yeah,
Okay.
for sure.
You relax.
I think the only one that I'm afraid
is
is
your
my
neck. Yeah, we're not gonna force that one.
Oh my god. I can do that. That's great. ¿Cómo te sientes? Amazing. Amazing.
When I adjusted the shoulder back, the whole shoulder came back, so the muscles here aren't used to it being all the way. Her shoulder's used to being here.
Oh my god. You want to look at me suffering? Yes. Ah.
That's your new friend.
Para que sepas lo mismo que sentiste con tu cara y tu pelo. ¡Ay, la puta!
Medellin's a great city. I've really enjoyed Medellin. The scenery is beautiful. You come out of the airport, you come down the hill, and all you see is this beautiful scenery. Mountains, city lights, you can see the river. And it's not too big. It's a lot smaller than a city like Bogota, which is more like the size of Chicago. So it's not too hard to travel around. You can take a taxi, you can Uber. So I've really enjoyed the people in the city. So if you're looking for something that's like a wellness vacation, I can't recommend Medellin nearly enough. We're gonna see how well my body changes over the course of the follow-ups, 15, 30 days. And really, I can't say enough about how great the staff has been at Bio Accelerator, incredibly professional. They know their stuff. I grilled the doctors up and down on the efficacy and the data, and they had every answer ready to go. I've been incredibly impressed by their laboratory.
And if you have any question, go ahead. We're super open to share.
Yeah, I mean, I think the major question that most people in the United States have been asking, because people are getting stem cells in the US now, is what makes the golden cells, what makes the mesenchymal cells different? One of the big misconceptions I think a lot of people have is where do those cells originate from? I think, a lot of misinformation and disinformation, people start to spread that maybe it comes from, aborted babies or embryos, and obviously I'm aware that that's not true, but hearing it from the doctors itself, I think is what people are really interested in hearing.
We work with the Wharton jelly mesenchymal stem cells. Those are the cells that we can get from the tissue of the umbilical cord. So there's some misunderstanding too about what is the blood of the cord and what is the tissue of the cord, because that we can get mesenchymal stem cells from the blood and we can get hematopoietic stem cells from the blood of the cord. But the ones that we get from the tissue are the Wharton jelly mesenchymal stem cells. Normally they are multipotent, but they can express, depending on how we grow them in the bank, cells from the bone marrow, they're not able to express those proteins as behaving as pluripotent. That's why we choose to work with the Wharton jelly cells. Depending on how we culture them, we can make them more anti-inflammatory. So that's like a super big difference of what you can actually get in the States. Cords are collected from healthy donors, volunteers, by C-section. In Colombia, it's prohibited to buy tissues. There's a lot. So we only get cords that are donated by very healthy moms. Many moms want to donate, and we have many moms in Colombia.
Right.
But we choose them going with a very specific inclusion criteria that if they don't accomplish all of those safety points, we cannot get that cord. And one of them is that it has to be on C-section because of the contamination of the vaginal channel. That way we can reduce the risk of bringing a tissue contaminated. So it has to be super clear that we're not getting cells from the baby, we're not getting cells from fetus of abortions, and we're only getting cells from a discharged tissue that is going to be thrown away and that is rich with a lot of cells. The tissue of the cord that you can see, the white part, is clean, is easy to dissect with our process and how we culture our cells and how we do all the process of expanding the cells.
And how do you do that? Is that grown on a medium?
Yeah, it's a culture media is an enriched environment of nutrients that we give the cells. So not only the nutrients, the oxygen, the CO2, all the gases, and the nutrients that can preserve the cells being there alive and dividing and dividing and dividing and giving more and more and more and more exponential cells. Let's say that you have a knee problem. just for an example. So they're gonna sense, this is something that is called homing. They sense where is inflammation and they go there because they are called to inflammation areas. So they're able to detect that inflammation. Then they go to the knee and they sense the microenvironment. This microenvironment is in this condition, so let's produce the opposite to control that environment. So it's inflammatory environment, they're gonna be producing anti-inflammatory molecules specific for that type of inflammation. Our body is like super perfect, it knows how to heal itself. But the thing is that we don't help our body to be in the perfect conditions to be able to heal itself. So we eat an inflammatory diet, we don't exercise, we are stressed, we don't sleep. So our body is not balanced, our body is unbalanced, and inflammation is super high. If we start doing things to cut inflammation as changing the diet, doing exercise, sleeping better, getting stem cells, and many other things that we can do to cut inflammation from the body, we're gonna be able to put our body back into balance, and when we are in balance, our body knows how to regenerate. So if we control inflammation in the knee, now you can start regenerating, now you can start healing yourself.
So are those stem cells just decreasing inflammation, or say you've got wearing down of cartilage, like there's less cartilage there, do those stem cells now go to those areas and those stem cells become new cartilage cells to create more cartilage? Is that something that they do?
No, what they do is that they release all this information, they cut inflammation, and they're stimulating your own stem cells that you still have in the knee to start reproducing, dividing, and creating more cartilage. So it's not that the cells that we are applying are going to turn into cartilage. It's not how that works.
Okay.
But they're able to do that better if there's no inflammation. We have seen evidence that show that actually, yes, you can create or regenerate the cartilage. That we're not gonna regenerate the cartilage as if it was when we were born or when we were super young, but yeah, we can help to regenerate a fine line that's gonna translate in less pain for the patient.
So one of the reasons I chose Bio Accelerator over some of the places in the United States is they use a different type of stem cell here, particularly the Wharton's jelly. So the Wharton's jelly, it comes from the cells that are around the umbilical cord. There are some finicky laws that date back to some of our previous presidents that have made it sort of difficult for patients in the States to get this kind of stem cell. So when we're talking about the types of stem cells in the States, we're dealing with bone marrow, we're dealing with fat cells, we're dealing with other types of cells. And what the data suggests is that the stem cells that are around the Wharton's jelly, meaning the type of stem cells that come from the umbilical cord, they have the ability potentially to turn into more types of cells than some of the cells that we have. Not only that, is if you're taking cells from your own body, whether it's your plasma, your bone marrow, your fat cells, those cells are your age. So when we're taking cells from an umbilical cord, those cells themselves are young, so that they're fetus age. So that age really makes a big difference in its ability for that cell to function properly. As we know, the older we get, the less our cells function in general, whether it be our skin, our immune system, our bones, we just don't heal as well over time. So even our own bodies aren't going to heal as well with their own healing factors if we take our own cells. So that was the thing that really drew me the most scientifically to Bio Accelerator, and there are only a few places in the world where this type of technology is available, and one of those being Medellin, Colombia.